Most people think neuropathy is a nerve problem. That's the first mistake because nerves don't function in isolation. They depend on an environment. And one of the most critical parts of that environment is blood flow and oxygen delivery. But not in the way most people think. Because when people hear circulation, they think, I just need more blood. More blood, better flow, problem solved. Now that sounds logical. It just doesn't explain what people actually experience. And that gap in understanding is where most people get stuck. Here is the shift. Nerves don't just need blood. They depend on stability of what I call the nerve environment. That environment includes oxygen delivery, nutrient exchange, and waste removal, and the conditions that allow those processes to remain stable. Not spikes, not occasional improvement, not temporary boost, consistency. Because nerves are highly sensitive tissue, they don't tolerate instability. And when the nerve environment becomes unstable, the nerve doesn't just struggle, it adapts. And it adapts poorly. That's when symptoms show up. Burning, tingling, numbness, altered sensation, loss of balance. Those symptoms, they're not random. They're signals. Signals that the nerve environment is no longer stable. Now, if we think of a nerve like a communication line, it carries signals from your brain to your body and from your body back up to your brain. But that line doesn't run on its own. It depends on the nerve environment to support it. It needs oxygen delivery, nutrient exchange, and waste removal. All of that depends on circulation. But here's the mistake most people make. They think if blood is getting to the nerve should be fine. But that's not how it works. Because circulation is not just presence, it's performance. And performance depends on delivery timing, distribution, utilization. And if any of those break down, the nerve environment destabilizes. And when the environment destabilizes, nerve function follows. There's a critical distinction most people miss. Delivery versus consistency of delivery. You can have blood reaching the nerve without having stable delivery over time. That means some moments are adequate, some moments are not. And that fluctuation matters. Because nerves require a stable nerve environment. If oxygen delivery rises and falls, the nerve is constantly adapting. It is constantly compensating. It is constantly under low-level stress. And over time, that stress changes function. Not just sensation, function. This is where symptoms start to make sense. Not as damage, but as instability inside the nerve environment. What people experience as good days and bad days is not random variation. It's fluctuation in delivery. Oxygen delivery is not steady. It rises, it falls, it shifts throughout the day. And the nerve is forced to adapt to that instability in real time. That is the mechanism. The variable most people overlook isn't flow. It's the timing of delivery within the nerve environment. When timing becomes inconsistent, function becomes inconsistent. That's why symptoms fluctuate, intensify, and never fully stabilize, because the system they depend on doesn't stabilize. Most people think about circulation in terms of the large vessels, blocked arteries, and major blood flow issues. But nerves rely heavily on microcirculation, tiny little capillary networks, and small vessel dynamics, local delivery systems. Now, that's where a lot of the dysfunction actually occurs. And that's why it's often missed. Because macrocirculation can look normal. Pulse may be present, major vessels are open. But at the micro level, delivery can still be inconsistent. And that alone is enough to destabilize the nerve environment. Even if oxygen is delivered, that doesn't mean it's being used effectively. Delivery and utilization are not the same thing. The body has to transport oxygen, release it at the tissue level, and allow cells to actually use it. If any part of that process becomes impaired, the nerve remains in a low function state, even when circulation may appear to be normal. This is why tests can look fine, but symptoms are still persistent, because the issue is not just the delivery, it's usable delivery within a stable nerve environment. Now we add another constraint. Because oxygen delivery happens inside a system influenced by what I call metabolic volatility. Blood sugar variability, inflammatory load, insulin resistance, and oxidative stress. These don't just affect health, they directly disrupt the nerve environment. They alter vessel behavior, capillary responsiveness, oxygen release, and cellular utilization. So even if the blood flow increases, metabolic volatility prevents stability. It introduces variability into the system. Different inputs, same outcome, instability. As long as instability exists, the nerve cannot maintain constant or consistent function. Many people notice symptoms worsen at night. That's not random. At night, movement decreases, circulation patterns shift, and sensory input drops. The body loses some of its compensatory mechanisms. So instability in the nerve environment becomes more noticeable. It's not that neuropathy suddenly got worse. It's that instability is no longer being masked. So the question becomes, if blood flow improves, why doesn't it hold? Because flow without stability does not correct the nerve environment. It temporarily increases the supply, but the constraints remain: timing, microcirculation, metabolic interference. So the system reverts back. Temporary improvement, then regression. Not failure of effort, failure of stability. This model explains why what people experience every single day. Symptoms fluctuate over time, worse than get stressed throughout the day. Because the nerve is not isolated. It is responding to the nerve environment, and that environment is not stable. This is where one of the most important concepts show up: false stability. The system can appear normal while still being unstable. Testing may show adequate blood flow, normal vascular findings, no major obstruction. But those are static measurements. They do not capture timing variability, microcirculatory instability, and oxygen utilization. So, the system looks stable, but functionally, it isn't. That's false stability. And that's why patients are told everything looks fine, while symptoms continue. This is where most approaches fail. Not because they do nothing, but because they address pieces, not constraints. They improve blood flow, inflammation, nerve stimulation. But the nerve environment is governed by multiple constraints. And if those constraints are not coordinated, the system cannot stabilize. And if the system cannot stabilize, results cannot hold. This is the difference between intervention and framework. Without a framework, every intervention becomes temporary. So when we talk about blood flow and nerves, we are not talking about a single variable. We are talking about a constraint-driven system. The nerves reflects the conditions of the environment it lives in. And if that environment is unstable, the nerve remains unstable. Blood flow matters, but blood flow alone does not stabilize a nerve. Stability comes from a system where delivery utilization and environment hold over time. Because nerves do not respond to intention, they respond to conditions. And if the conditions are unstable, the outcome will be unstable every time.